This module will talk about what is sound and what types of stimuli do we use for acquiring a brainstem auditory evoked potential. The sound that we hear is made up of sound waves that travel to our eardrums and activate our eighth nerve. Sound can be described along three dimensions. Pitch refers to how high or low the sound sounds and is measured in hertz. High-pitched sounds have more high-frequency waves in them, and they activate the basal end of the cochlea, that is, the end closest to the eardrum. Low-pitched sounds activate the receptors further along the cochlea towards the apex, and therefore will have slightly longer ABRs due to this travel time. The second parameter, intensity, refers to the loudness of the sound. Loud sounds have higher amplitude sound waves, while quiet or soft sounds have lower amplitude waves. Loudness is measured in decibels, which we'll talk about on the next slide. The third parameter, timbre, refers to the complexity of the waveforms or the quality of the sound, and it's often used in describing instruments or voices that create the sound. We do not measure timbre when we are acquiring a brainstem auditory evoked potential. As mentioned on the last slide, sound intensity or loudness is measured in decibels and reflects how much pressure the sound waves exert against the eardrum. Loud sounds exert a lot of pressure, while quiet sounds exert a little. Decibel meters, or dB meters, are instruments that measure the pressure exerted by the sound. When there is no sound, absolutely no sound, it has a reading of 0 decibels. A hearing loss is defined as an inability to hear at 40 decibels SPL, and speech is typically spoken at around 60 decibels. So in our evoked potentials testing, we often begin at 70 decibels, and then we go up as required, or we get louder as required. There are 3 decibel scales that are used, and so whenever a dB level is reported, the type of scale also needs to be reported. The decibel scales are as follows: dB SPL, dB NHL, and dB SL. And I will describe each of those in turn on the next slides. The first scale that I will describe is sound pressure level, or SPL. This is the most objective scale. It reflects the actual intensity of the sound that's needed to exert a certain pressure at a certain frequency at sea level. If this scale is used, then the sound intensity will be the same regardless of the location where the sound is played or the person hearing it. Sometimes different frequency sounds sound louder or quieter to different people, or in different environments, or at different altitudes. This does not matter. A measurement using dB SPL means that it is the same physical loudness, it exerts the same amount of pressure, regardless of all the other factors. The second scale that I will describe is commonly used in audiometry labs. It is called dB NHL, or normal hearing level. It's defined as the average threshold intensity for a group of normally hearing adults. The scale is used in certain places. For example, a lab that has a noisy background environment. In a place like that, where there's a noisy background environment, sounds might need to be played slightly louder for people to hear it. And so if the dB SPL, the objective measurement, were used, many normal people might look like they have a hearing deficit. However, if dB NHL is used, then this takes into account the noisy environment by looking at the hearing threshold for a group of normal people. Therefore, this scale is location-specific and needs to be recalculated if the evoked potential system is moved to another environment, because in the other environment, the background noise levels would change. If the stimuli used to test a group of normal participants are pure tones of at least half a second duration, which is the standard, then this scale can simply be called HL, hearing level. The N, the normal part, is dropped. It's just called HL. But if shorter tones or clicks are used, then the scale is called NHL, or normal hearing level. The third decibel scale is dBSL, or sensory level. This is the hearing threshold for a specific person, for one individual person. And this is calibrated so that when the person starts to hear, that is their 0 dB SL. In a normal participant, the SL, sensory level measurement, should be the same as the group measurement, or the NHL measurement. In a patient with reduced hearing, however, the difference between the sensory level, or SL level, and the NHL level would show the magnitude of the hearing loss for that person in that environment. Hearing thresholds are measured by increasing and decreasing the stimulus intensity in 5 decibel steps, and asking the patient when they begin to hear the stimulus or when they stop hearing the stimulus. This point, when they begin to hear the stimulus or when they stop hearing the stimulus, is the 0 dB SL level. This is the hearing threshold. Note that the dBSL cannot be reported in infants and young children. It also cannot be reported in unconscious patients, as a behavioral response is required. It's important to know how to convert between the decibel scales, and there's a separate module where we will work through some examples together. We will now talk about the stimuli that we use to evoke a brainstem auditory evoked potential. Either clicks or tones could be used. On an oscilloscope, clicks are seen as square waves that are made up of different underlying frequencies. It combines different frequencies together to make a square wave, while tones are usually made up of only one single frequency. Clicks are preferred for studies that ask a neurological question, as they have a sharp onset and they test a number of different frequencies at the same time, and so this produces a clearer auditory evoked potential. In audiology, however, clicks are not preferred as they activate a number of different frequencies, but not all of the frequencies. And in audiology, they're interested in looking at all of the different frequencies. Tones are preferred in audiology as individual and specific frequencies are tested one after the other. Some other characteristics of the auditory stimuli that we need to consider are its polarity and stimulus rate. Polarity refers to how the sound waves interact with the eardrum. If the sound wave pushes on the eardrum, then it exerts a positive pressure on the eardrum. It's also called a condensation wave. If the sound wave exerts negative pressure on the eardrum, that is, it pulls on the eardrum, it's a rarefaction wave. Knowing whether the stimulus polarity is positive or negative is important because a condensation wave causes a slightly shorter wave 1 than a rarefaction wave, because the condensation wave pushes the eardrum in and reduces the travel time to the 8th nerve, while the rarefaction wave pulls the eardrum out and increases the travel time slightly. In our lab, we use what's called an alternating stimulus, where it alternates between a condensation and a rarefaction click. So every other click is a condensation or rarefaction click. And so this way, the difference in travel time averages out, and the averaged travel time is used to generate the latency of the wave 1. Stimulus rates refer to how quickly the stimuli are presented, and it's measured in hertz, or numbers of stimuli per second. It reflects the refractory period and myelination of the nervous system. When the nervous system is immature or damaged, then it may take longer for signals to travel and for the nerve to reset. And so a slower stimulus rate may help to give a better looking evoked potential. In most populations, a stimulation rate of 8 to 10 hertz is recommended. We often use 11 hertz as a starting point. This means we present 11 clicks per second. We can slow the stimulus rate in young children and lower it even further in neonates. Changes to the stimulus rate must be noted on the tracing for the person who is interpreting it. When doing a hearing threshold test where we're only looking at the wave 5, a very fast stimulus rate of 50 Hz is used. The last characteristic of the brainstem auditory evoked potential stimulus that I will discuss is the use of a masking noise. A stimulation of one ear causes bone conduction through the skull to the other ear. This cross-stimulation creates an evoked potential in the other ear, and this interferes with the evoked potential that we want to acquire of the stimulated ear. So typically what we do is we present a masking noise to the ear that's not being stimulated. This masking noise is a constant white noise which is made up of a broad band of frequencies and is presented at 40 decibels below the loudness of the stimulus click for the stimulated ear. And this masking noise will mask out the generation of an evoked potential because it does not have an onset or offset. It's constant. And so because there's no onset or offset, then there's no time locking to create an evoked potential in the other ear. This brings us to the end of this module. However, it's important to learn and practice how to convert between decibel scales. So please try the exercises in the module on converting between dB scales.